Welcome to Toledo Clinic TV. Our guest for this segment is Dr. Marie Wolfe. You're a primary care physician with a specialty in internal medicine. What you're here today to talk about is an exciting new line, advice line, for lack of a better word. It's called My Toledo Clinic Nurse. Tell us about it.
Yes, you know, we're very excited, Heather. It's nice to be here, and I'm pleased to talk about something that we're offering to the patients that are already connected with primary care physicians at the Toledo Clinic. So many times what patients will say, well, the office was closed and I didn't know what to do. So this is an additional layer of access where you can call your primary care physician's phone number, and this will pass through to a group of registered nurses that are part of our team that are there just to answer your questions. Their only task is to assist you. So it's personal, they can access your medical record, it's confidential, and there's no additional charge if you're a primary care patient through the Toledo Clinic. So we've always focused on, quality, value, and we're trying to improve access. So many times physicians will get calls the next day saying, well, I didn't know what to do. So this is a team of registered nurses that are going to be able to access your medical record, both through the Toledo Clinic and through other services, and answer your questions with information that they have and make it more personal. So if you say, well, look, I was in the hospital and they started me on a medication. Am I supposed to continue to take that? How do I take it? And the nurses can look and see, is this something that we can answer? Now, if you say something that's much more concerning, they may say, you know what, I think you might need to come in and see the doctor, and they're going to have access to our schedules so that they can put you in and say, look, Heather, would you like to come in tomorrow morning at 10:30? You sound like you're fine for tonight. Let's get you in with the doctor tomorrow. And then it's done.
So there's some peace of mind to this too, that you have access to someone. Is it 24/7?
So what we're going to be offering, we have 24/7 on-call services, but this is an additional layer where we're going to have the registered nurses that are part of our team taking calls during the week from 4 till midnight. There will still be somebody taking calls at the other times, but this is when the phones are off at the primary care doctor. And then on holidays, from noon to 8 p.m. and weekends. So a lot of times it's just that reassurance that you say, can I go to the pharmacy and take something for my cough? I'm on these prescription drugs, is it going to interact? And we can say, yeah, it can. So what we're trying to do is avoid an unnecessary emergency room visit, an unnecessary urgent care visit, and unnecessary concern from a patient or their family that I didn't know what to do, so I just, went to the emergency room. And many times the answer that the ER says is you should call your primary care physician. So we want to reach out to those people that are our patients and say, look, think of us first. If it's a life-threatening condition, no. But if not, these are going to be registered nurses that are going to be there providing this personalized care with your health information in front of them. If they feel it's urgent, they may direct you to the urgent care or the emergency room. If not, they'll answer a question. If they feel that they need to speak to the doctor, they will access us and we'll make a shared decision-making plan with the patient, with a registered nurse, and with the doctor.
Not only is it reliable, but it's super convenient to make that call.
Right, we're in a 24/7 world, so you may have a mother who's a patient of ours. You are on HIPAA, you're allowed to call. You may say, look, I went after work and my mom was having a concern. And you can call us and we can decide, well, mom, doesn't need to go to the emergency room. Why don't the two of you come in? Here's an appointment time, does this work? And then we go from there.
It's great too, because I'm thinking it's also cost effective if you
Right.
can avoid a costly
Right.
ER visit.
Yes.
And the hassle of going to the ER.
Right. So, a lot of times we also hear from patients, I went to the emergency room, it was a 5-hour wait, I waited 4 hours, I couldn't take it anymore. And so we just want to avoid that step if it's not necessary. Yeah. So like you said, it's confidential, it's personalized with your health record available to us, and there's no cost. And then we connect you through primary care to all the services that we have through the Toledo Clinic. I mean, we've been around for nearly 100 years. We're doctor owned and operated, and we just are expanding and thinking about what's the next 100 years, and we want to have more access.
Yeah, meeting patients where they are.
That's exactly
Yeah.
right.
All right, so how do you call the tip line, the advice line?
So you can call your primary care physician through the number that you always call. If they're open, they'll answer. If not, this will go seamlessly through to the registered nurses that are sitting waiting with one task: to meet your needs. And the primary care team wants us to be your go-to. We want to connect you with all the wonderful services and specialists that we have through the Toledo Clinic and our support services, and we just want you to think of us first.
Yeah, it's a great additional service. Dr. Wolfe, thank you so much.
All right, you're welcome, Heather.